பிறப்பில் ஆக்சிஜன் நிரப்பி அங்கே உனக்கொரு வீடு செய்வேன். உன்னுயிர் காக்க என் உயிர் கொண்டு உயிருக்கு உயிரால் உரையிடுவேன். வேகத்தை திணித்து மெத்தைகள் அமைத்து மெல்லிய பூனை தூங்க வைப்பேன். தூக்கத்தில் மாது வேர்க்கின்ற போது நட்சத்திரம் கொண்டு நான் துடைப்பேன். பால் வண்ண பறவை குளிப்பதற்காக பனித்துளி எல்லாம் சேகரிப்பேன். தேவதை குளித்த துளிகளை உயிரை குடிக்காது. அன்பே அன்பே கொள்ளாதே, கண்ணே கண்ணை கிள்ளாதே.
The information provided in Doctor's Corner on Southside FM is intended for general informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Listeners are strongly encouraged to consult with their qualified healthcare professionals, including their general practitioner, for personalized medical advice tailored to their individual needs. Any actions taken based on the information presented in the medical talk shows are at the listener's own risk. Medical decisions should be made in consultation with your licensed healthcare provider.
Good evening and welcome to another live broadcast of Doctor's Corner on Southside FM 107.2, where we are discussing all things medical. You are back with me, Dr. Prabhashini Kupsami. I am a general medical practitioner in private practice with a specialty qualification in aesthetic medicine. You will find me here every Thursday between 7 and 8 p.m. as I bring you cutting-edge and up-to-date current information on relevant health topics. Welcome to Southside FM 107.2. Last week, we had a homeopathic doctor in studio discussing the role of alternative medicine in disease. If you missed that broadcast, you can find it on our Facebook page or on YouTube, Southside FM South Africa. This week, we are welcoming back dentist Dr. Devin Chetty, one of our previous guests, and we are chatting about aesthetic dentistry. So stay tuned.
Just come along for the ride. Oh, my outfit's so tight, you can see my heartbeat tonight. I can take the heat, baby, best believe that's the moment I shine. Cause every romance shakes and it bends, don't give a damn. When the night's here, I don't do tears, baby, no chance. I could dance, I could dance, I could dance. Watch me dance, dance the night away. My heart could be burning, but you won't see it on my face. Watch me dance, dance the night away. I'll still keep the party burning, I won't get out of place. Lately, I've been moving close to the edge, still be looking my best. I stay on the beat, you can count on me, I ain't missing no steps. Cause every romance shakes and it bends, don't give a damn. When the night's here, I don't do tears, baby, no chance. I could dance, I could dance, I could dance. Watch me dance, dance the night away. My heart could be burning, but you won't see it on my face. Watch me dance, dance the night away. I'll still keep the party running out one day out of place. When my heart breaks, when my world shakes, I don't play it safe. Don't you know about me? I could dance, I could dance, I could dance. Even when the tears are flowing like diamonds on my face, I still keep the party going, not one hair out of place. Yes, I can. Even when the tears are flowing like diamonds on my face, yes, I can. I still keep the party going, not one hair out of place. Watch me.
Our guest is in studio and we are talking about aesthetic dentistry. Our WhatsApp lines are open for questions throughout the show, so make sure you send in your questions or your comments as there is a Q&A segment at the end of the show. And the number to send it into, as you all know, is 074 345 4447. You can also catch us now live on Facebook and on YouTube, Southside FM, South Africa. It gives me great pleasure to welcome back to the studio Dr. Devin Chetty. Dr. Chetty, welcome to Southside FM. And thank you for coming through to share some of your invaluable knowledge, your expertise, and your management skills with the listeners of Southside FM.
Good evening, Prabhashni. Good evening to the listeners. It's absolute pleasure being back and looking forward to the show this evening.
Dr. Chetty graduated from the University of Western Cape with his bachelor's degree in dentistry. Following in his father's footsteps, the renowned orthodontist Dr. D. Sundram, he served his community service in the military and stayed on for a further 7 years, where he served not only as a dentist, but a soldier and a military member as well. During the COVID pandemic, he was a member of the COVID testing team for the SANDF members in KZN. He ventured into private practice in 2021 and as an after-hour clinic until he resigned from the military to be in full-time private practice, which is where he is now. Dr. Chetty practices in Pearls Med at Pearly White's Dental Studio. The practice is situated at the Pearls Mall in Umhlanga. He incorporates modern techniques and pioneering advanced technology and techniques at his practice to deliver the highest quality of care for his patients. And most importantly, he strongly believes in preventative dentistry, as we spoke about the last time. And this fuels his enthusiasm in aesthetic dentistry. And this is a topic right up my alley. So, but Devin, before we start, I want to know, because with all the controversy that's been happening now, with even medical students going to medical school and then coming out of comm service and having no job, what advice would you give to students who are considering studying dentistry or who just started? Would you advise it? Don't smile, because I know what you're going to say. Let's not be honest. Let's be logical.
Okay, look, if you are passionate about dentistry and if you or in following in a family's members' footsteps as well, definitely, by all means, apply. If you are a dental student already and are thinking about ComServe, my advice would be apply to the military. That's going to be your best bet. And yeah, just know if you do want to do dentistry, it is 5 years of, I'm not going to say hell, but hell with a smile.
Okay. So with that said, let's just get into the main topic. Now, what is the difference between general dentistry and aesthetic dentistry?
So your general dentistry, that would just be your basically the bare minimum of stuff. General cleanings, fillings, root canal treatments, those kind of things we would consider general, just basic dentistry.
Okay.
Aesthetic dentistry, we sort of, we tend to, now we're venturing more towards the front of the mouth, the aesthetic zone, essentially. You'd know a lot about that as well. So that brings into play a lot of crowns, veneers, bridges, anything that a patient's going to come to you and ask you, listen, I'm unhappy with the way I look. I'm unhappy with the way my smile looks. I'm unhappy with the way my teeth look. Then you're going to be doing some aesthetic dentistry for them.
So essentially it's specialized dentistry.
Somewhat, yes and no. It's, there's a lot of courses and diplomas and things out there that you as a dentist can do. But if I would highly advise it for any dentists that are willing to do aesthetic dentistry and want to, start working on people's front teeth. It's a big responsibility. I wouldn't recommend it if you haven't had any prior knowledge or education or training, especially hands-on training. Because
Yes.
if you mess it up, that patient comes back to you, they're not going to be happy. You generally only have one shot at doing it,
Okay.
especially if you're doing a permanent crown or a permanent veneer. You're cutting away the tooth. You only have one shot to get it right. The tooth's not going to grow back, unfortunately.
Okay.
So I would say, yes, aesthetic dentistry is slightly more specialized work in the sense that there's a lot more that goes into it. But it doesn't mean to say that any general dentist can't do that work.
That was my next question.
Yeah.
Can just any dentist do aesthetic work, or is there a special qualification that has to be done?
So, look, it all depends. It's up to the dentist, I suppose. There are going to be the dentists out there that are feeling very brave and will be more than willing to, partake
Replace the
and
tooth fairy.
replace the tooth for you. And, because aesthetic work, big aesthetic work, it costs a lot of money.
Yes.
Pravashni. Now, the dentists, they know that. So a lot of dentists out there prefer to cut corners and not go for the training. And then they end up getting, they bite themselves in the bum eventually because it's their own mistake. So I've attended multiple courses. I haven't done any postgraduate diplomas per se, but I've attended multiple courses that have been, hands-on training courses given to me by world-renowned dental specialists.
Okay.
So even just by going and attending these courses, 2-day courses, 3-day courses on whatever the topic may be, you as the dentist, you are upskilling yourself.
Yes.
And dentistry, and I'm sure in aesthetic medicine as well, the technology and the things that are out there and advancements are moving at such a rapid rate.
Very rapid pace. Yes.
Which is why we have to continually go and attend CPD events.
Yes.
Now, most of these courses and stuff, they give you CPD points if you attend them, right? So, yeah, I wouldn't be comfortable going to a dentist and asking him to do any aesthetic work had he or she not gone and done any prior hands-on training.
Bottom line, it's specialized dentistry.
Yeah,
It
is.
That's exactly what I would say. All right. And in saying that, it is expensive, right? But like you said, you have one shot at it. And if it's not done correctly, there's also other things that can happen in terms of causing a problem that was not there initially. So you have
Precisely.
to be, you have to see the certificate on the wall. I always say that. Okay, so maybe you can give us some examples of corrective work that can be done when it comes to aesthetic dentistry, and then we can then discuss each one.
Okay, so let's use terms that I know our listeners will be
familiar with. Yes.
Right? So the basic ones we can obviously start with will be crowns, veneers, teeth whitening, and bridges and implants as well.
Okay.
Right? So those are what we call considered crown and bridge work, right? Although there can be a lot of aesthetic work that can be done just by fillings as well.
Okay.
So a lot of patients come and have cavities in between their front teeth, right? Into proximally in the middle, or their front teeth are just not looking too good. So you can treat those cavities just with basic fillings that match the actual tooth color. And if done correctly, there will be no evidence of the cavity there at all.
Okay.
Right. So that would be the bare minimum. And then we move on to crowns, bridges, veneers, which require a little bit more intricate work.
Okay. So I think just to define it or dumb it down a bit more, maybe you can just tell us what each one means. Because to me, all of those sound like exactly the same thing.
Yeah. So a crown, essentially what a crown is, and people can see, if you can see me.
We should have brought.
I should have actually. You should have told me. And you should have also told me not to wear red, because now my head is floating in the background. But so what a crown is, essentially we're replacing the whole surface of the tooth, right? So the tooth, you shave away the enamel all the way around and over the top, right? But it sounds hectic by shaving away enamel, but remember, the crown is now fitting over the preparation that you have now prepared.
Okay.
Okay. So generally speaking, we're not going to cut a healthy tooth.
So I'm assuming it's not done on.
It's not done
but it should be done on a healthy tooth in terms of no infections.
Correct.
in the tooth,
Yeah.
right?
So in dentistry, we term a healthy tooth a tooth that's not had any work done on it,
Okay.
right? So no fillings, nothing. It's a healthy tooth.
Okay.
So generally, crowns will never be done on a healthy tooth. But let's just say you've got a molar and you've had a root canal, or you've got a large filling on that tooth, right? You can get and you will get good function out of that. But if you're looking for longevity purposes, get a crown done. Because what the crown does is, so you've got your shell now and you've been worked on, the filling is on the inside. A crown, by just creating a little bit of space by removing a millimeter of enamel or millimeter and a half all around the tooth, a crown is then 3D printed out in the dental lab, right, out of zirconia or whichever other material. Zirconia is what we use now, and permanently cemented over that tooth. So the entire tooth basically is replaced. The outer shell is replaced with the core remaining of your internal actual
Okay.
tooth. So that crown cemented over that is permanent, and it is incredibly strong. So what I would say is, if you to the listeners out there, take a look at your back teeth. A lot of you, if you have had quite a lot of fillings or very large fillings, or if you've had a root canal done on the tooth, rule of thumb, generally speaking, recommended to get a crown done on those teeth for longevity purposes.
Okay.
Because the moment enamel is cut and replaced and joined with the filling, there is some compromise, and there's going to be a chance that it's going to break, or the enamel can break, or the filling could chip.
Yes. Yeah.
So the crown will go over that and literally just
Seal
protect
in.
everything inside.
Okay.
So that's
Sounds
a crown.
very fancy. Okay.
Actually, crowns have been done, since dentists actually could have a motorized handpiece. And they used to just build up the crowns by hand. So that would be a crown, right? Then we get a veneer. A veneer is only done on your anterior teeth. Veneers are not done on posterior teeth, right? So veneers, essentially, a crown, we shave away the whole tooth. A veneer on an anterior tooth, we just shave away the facial aspect. So the surface that we see.
What that we can see. And
Yeah.
for the listeners out there, the anterior teeth are the ones in the front.
Yeah, the anterior teeth are your front teeth, right? From canine to canine on either side. Now, veneers are done to replace your smile, really, for smile design, smile improvements. People are unhappy with their front teeth. Veneers is the word that you hear thrown in there the most, right? Aesthetics, I'm going to go get veneers. So a veneer would be done on your front tooth. Again, it's up to the patient, really, essentially, again, have your front teeth had quite a lot of fillings done? Go and get veneers done, because you're going to protect it. It's going to be a permanent solution, right? Plus, it's going to look amazing because the veneers also are all 3D printed out of zirconia nowadays, which is absolutely stunning, and it's rock.
Is that the
hard.
same terminology when they mentioned the word porcelain?
No.
No. that's
Porcelain
different.
is different.
Okay.
Yeah. So porcelain is a different material. Porcelain is actually hand built up, but a dental technician knows a bit more about
Yes.
that. Zirconia is actually, it's a monolithic zirconia. It comes out of a block. You put it into a milling machine. The crowns and the veneers are designed on computers these days. So the world of aesthetic dentistry has changed completely. But since we're just talking about what each one is, a veneer is you're basically just replacing the facial part of your tooth. So you're not happy with the way your tooth looks. If you've had lots of staining, even if it's kind of chipped in half, you can still get away with just doing a veneer, which is a minimal preparation.
And that is individual.
Yeah.
Okay.
So
So
those
I'm
are
assuming only adults get these treatments, right?
not necessarily at all. But essentially, you'd want the growing to be complete. You want all teeth to be in their mouth. You would want to know, okay, not much growing is going to be done after that. But we do
Obviously,
also,
because it's a permanent solution.
correct.
Yes.
Yeah. But we do also get kids and stuff that their teeth are, sometimes they haven't looked after their teeth well enough from when they're young. So they're going to get their fillings in their permanent molars at a much younger age. And it does not mean that a crown cannot be done, because a crown still fits onto that tooth. So even if the tooth is going to be moving, the crown essentially moves with the tooth. It's like a normal tooth again.
Okay.
So, don't be afraid of going and chatting to your dentist about crowns and veneers if you're unhappy with certain things.
And if the teeth are normal, but it just looks odd, I mean, to the person, can you still then do a crown and a veneer? Because ultimately, aesthetic, whichever way we're doing dentistry medicine, is just more about enhancement and to make the patient more satisfied with the way they look.
Correct. Now, as I mentioned before, we're not, there are dentists out there that will tell you, no, there's no such thing as a healthy tooth, right? I've heard that told to me before by well-renowned dentists. But personally, I don't believe in that, right? So essentially, no one will really be comfortable into cutting away into a healthy tooth.
Yes.
Because once, teeth, they're not like bones. We break a bone, the bone regrows. Our teeth and enamel, once the enamel is broken or it's gone, it's gone. It's never going to come back.
Even with Colgate?
Colgate might get you close. But so once you cut away enamel, there's no going back, right? So what I always tell my patients, so if you're unhappy with the way your teeth look, I would say consider crowns and veneers. If you've got internal stains on your teeth, fluorosis staining, tetracycline staining, antibiotic staining, stains that are intrinsic, that are in your tooth, that no amount of brushing and flossing and scaling and polishing is going to take away, then yes, your tooth, I would recommend going and getting veneers done.
Okay.
Right? But before anything, my dad will be very proud of me for saying this as well. Your teeth have to be in the correct position in your mouth.
Yes.
For the aesthetic work to now actually work. So yeah, that's another conversation that we'll have.
Okay, we're coming to that.
We're coming to that.
All right. And then okay, we went to the chew, a bridge and an implant.
So a bridge essentially is what we're going to do is an option of replacing a missing tooth, right? A bridge, it spans a gap. So you've got a tooth, a missing tooth, and a tooth. Now, a bridge, what we would do is how I explained, we prepare the tooth for a crown. We prepare the teeth on either side of the gap for the crowns, right? And then the dental technician makes the bridge. So there's two crowns with a tooth in the middle that's attached to the two crowns.
Okay.
You with me?
Yes.
So it's
like a Bugs Bunny thing.
Exactly.
Okay.
But it's tooth, right? And it cements down, and that tooth basically spans the gap. And you get beautiful aesthetic results with that. So it's considered a cheaper option than implant, right? But also, so let's talk about an implant now, right? So an implant.
But the bridge, is that removable or is
no.
Is that permanent?
An implant is a bridge is cemented in permanently.
Okay.
Yeah. Only dentures, false teeth, that's removable.
Okay.
Okay. So crowns and bridges are permanent.
Okay.
Okay. We say 10 to 15 years being permanent. Sometimes they might pop off, but if they do pop off, and granted the tooth and you've been looking after it, it's very easy to just re-cement it back on.
Okay.
Again. All right. So a bridge, two crowns spanning the gap, cemented down permanently. Okay. An implant is a screw into your bone, right? Letting it heal with a crown that screws into that implant.
Okay.
So an implant is basically considered, first choice for replacing missing teeth. It's the best option. It really is the best option. You basically get a brand new tooth, and it's done essentially painlessly, right? But there's a lot of factors that have to be taken into consideration before you consider a patient to have an implant. And, is the patient a chronic smoker? You have to look at the age of the patient. You have to look at the immune,
status of
the
them
immune
as well.
status of the patient. Diabetic patients, unless it's really well managed, it's one of the slight contraindications. It's not a major contraindication, but if you,
But they really wouldn't be a first line candidate.
it wouldn't be a first line candidate because obviously, being diabetic, you are slightly immunocompromised already.
A lot of immunocompromised already. Yeah.
Correct. So an implant, you're replacing the tooth with a screw into your bone. It sounds hectic, but it really isn't. A single implant or even two single implants can be placed in the chair under local anesthetic.
Okay.
You don't feel a thing. Once that little injection is in and the site is numb, the implant is placed in 20 minutes. Site is healed up, sutured up, and then you got to wait for 3 months for the bone to integrate around the implant. And then once the bone is integrated around the implant, you go back to your dentist. He takes a scan of you put a little thing in there, take a scan, that goes to the dental lab, and then the technician, same 3D prints out a crown, but this won't be a crown fitting over anything. It'll actually be a whole tooth with a little hole in the middle, right? And that fits over the implant with a screw down the middle of the tooth, screwing into the implant and sealed off permanently.
Okay, so it's a two-phase procedure.
It's a two-phase procedure.
All right. Okay.
So just to quickly add on, we often look at bridges if patients don't meet any of the criteria for the implant,
Okay.
or if it's slightly too expensive for the patient, then we look at doing a bridge. Because when you're doing an implant, you have to take into consideration how much bone that the patient has left. You have to do x-rays, CBCTs, check the health of the bone. It's a lot of check boxes that have to be ticked before you can actually place that implant. A bridge, we can kind of eyeball it and get away with it and still do an equally as beautiful job with just as amazing function as an implant.
Okay. But how's your feeling on just removing all the teeth and just putting in dentures then?
Definitely not.
Not?
Definitely not.
Okay.
Definitely not. If you're really that unhappy with your teeth, come and see me. And we'll have a chat. And I will convince you that you actually have beautiful teeth. I promise you.
All right. So there's one other question that I want to ask, because patients always ask me this and I don't know anything about it. In terms of root canal therapy, what is the advantage of doing, or what exactly is a root canal procedure, and the advantages over having just an extraction?
Okay.
If you're not using the tooth.
Yeah. So essentially, when you'll only have to do a root canal on the tooth, Prabhashini, if the cavity has actually gone deep enough into the tooth, right? So in the center of our tooth, we've got a pulp chamber. Now that
I remember that part from science in school.
Yes. So the pulp chamber that then extends down into the canals of the roots, right? And that's your blood vessels and all of those.
And the nerve.
Yeah.
As well. Okay.
Correct. Now, our teeth are made up of layers. There's enamel on the outside, right? And then there is dentine underneath it. So it's enamel, dentine, pulp, right? And now if you get a cavity, if your cavity is just in your enamel, you can fix it. The dentist can fix it with no anesthetic at all.
Okay.
The moment the cavity goes deeper into the dentine, that's when you need an injection and then a filling.
Okay.
Right? Now, let's say one of two things. You have not gone and gotten your filling fixed, and it's just progressed and progressed and progressed. Or someone's had a filling and it started to leak over time, and then decay has now formed beneath that filling. Granted, the patient's only going to know once an abscess forms.
Yes.
Right? That's the pain, and that's the toothache, and that's just terrible. We all know that. Now, that means as soon as there's an abscess, that means that infection has reached that pulp chamber. And that's when you have two options. Well, as a dental practitioner, you give the patient two options. Okay. Number one, do you want to save the tooth, at least for the next 5 to 10 years, right? And you'll only give them that option if they came to you at the right time and that there's still just enough tooth structure left to salvage,
okay.
Right? That's when you sell a root canal. And essentially what we do, you clean up all the debris and you go down with little files into the canals and we remove the nerves out of the tooth. So the tooth is dead, essentially, after that, which means that there's going to be no more feeling on that tooth. So no pain, no feeling. Fill up the roots with some nice medication that we put in there, a permanent filling, right? And then a crown on top of that. And then you can confidently say you've saved that tooth.
So the advantage of that obviously would be the tooth staying in your mouth.
Correct. Yeah. So that's the major advantage. The tooth is still going to be in your mouth. The obvious disadvantage is it's not going to be there. But, a root canal is a 2 to 3 visit procedure. And it is quite an intricate procedure. So a lot of patients don't really like to actually go through that. A lot of patients, if they have the means, will just say, you know what, doc, extract it and let's either do a bridge or extract it and let's wait for things to heal and we'll do an implant eventually. Okay. So you got to take things into consideration. But the rule here basically, Prabhashini, is don't let it get to that stage.
Yes, we're missing the point here,
Yeah.
right?
We're missing the point. We're
Preventative
talking
dentistry. We spoke
correct,
about this
correct.
before.
We're talking about all the
Yes.
fancy things to fix the teeth, but we need to add in there, don't let it get to the stage that you need a root canal. But if you do need a root canal, don't be afraid, because you're going to save that tooth
Yes.
if it's done properly.
Okay.
So it's going to be a little bit painful. I mean, vanity is pain, right?
There's no pain, no gain. Absolutely.
So,
Yes.
but again, that's the advantage. You're going to save the tooth, or you're going to not have a tooth there.
So, what are some of the common conditions, dental conditions that exist that would require us to actually want to do aesthetic dentistry?
So, yeah. So, I mean, the first thing that I mentioned would be obviously if you've had a lot of work done on your front teeth. Have you had a lot of fillings done? And those fillings have started to stain now, and you're just overall not happy with the way the current work that you've had done, then yes, go and do aesthetic dentistry, right?
Okay.
I'll tell you exactly what we would do going forward thereafter. Another thing, and it's quite common, is fluorosis stains. Now, a lot of parents, older parents, our parents, they used to feed us fluoride tablets, and it was all about fluoride and fluoride and fluoride. And what happens then is, when the permanent teeth erupt, they erupt with fluorosis.
Okay.
Right? So it's a term. It's called when you have patchy, your teeth are not weak or brittle or anything, but they are permanently stained.
Okay.
And it can range from minor to really, really bad. And then, yes, your only option then is permanent aesthetic dentistry. So then you're going to have to go and look at getting veneers done.
Okay.
Another thing would be tetracycline stains. So basically, like intrinsic stains that can't be removed and are contributing to your overall, you're not happy with the way things look, then yes. Again, you may also just have oddly shaped teeth. Your teeth might not be actually shaped, and it might not match your facial profile. And then nowadays, what we do is we do a digital smile design. So we actually take a scan of your teeth, a 3D scan. We take pictures, and I design a smile for you. And
Wow.
I AI impose the smile onto your face on the on the computer, and we can sit like we are now and discuss your smile. And
That sounds very cool.
It's amazing. It is really, really amazing. So that's where aesthetic dentistry has got to now. It's not just, you need a crown, you need a veneer. Okay,
Yes.
cool, we can do it. Now we can actually plan and show you what your smile is going to look like before even touching your tooth with the drill.
And in 6 months' time, you're going to be able to take that smile and just put it in there with.
Not even 6 months, in a couple of days. Literally, if after we do a digital smile design for you and you're happy, that's all done on the computer. That then we give to our dental lab, he gets it on his computer, and he actually 3D will now print out a model of your teeth with having the new teeth on them. So it's quite amazing.
Yeah.
It really is quite amazing. So the world of aesthetic dentistry is it's advanced at such a rate now that is unbelievable.
And still going strong.
Yeah. One thing I must add, though, based on the question that you asked me, one contraindication to getting veneers and crowns, in my opinion, is if you are unhappy with the way how your teeth are, if they are malaligned.
Malaligned, yeah.
Right? Don't go for the quick fix and to go get crowns just so that they're all nice and even. Please go and get braces or go and get aligners and get your teeth into the correct space. And I promise you, once you get them there and you have a look at your whole profile in the mirror and smile with even correct teeth,
it actually does. It looks different.
Completely different.
Yes.
I had a patient that came to me, and her 4 front teeth, she wasn't happy with them. So I asked her, what aren't you happy with? She said that they skew. So I said, look, just get them straightened. They were the most beautiful teeth. She said, no, I don't have the time for that. I said, okay. She said, crowns. Now, what do we do? You have to give the patient what she wants, but it's done under duress, because it's
that
not.
Situation could have been avoided.
It could have been avoided, but if I hadn't done it, she was going to go and get it done somewhere else anyway.
Yes.
She literally went for a second opinion, that dentist told her that the same thing, rather straighten your teeth. She came back and she said, no, I'd still want to go for the crown. So, there's a lot of things that you have to weigh up. Remember, once you cut away healthy enamel, it's never going to
There's
come
no
back.
turning back. Yeah. Okay. So you can keep your WhatsApps and your questions coming for Dr. Chetty, and we will be back on your airwaves after this.
Mr. Worldwide to infinity. You know the roof on fire. We go boogie, oogie, oogie, jiggle, wiggle, and dance like the roof on fire. We go drink drinks and take until we fall out like the roof on fire. Like the roof on fire. Tell her, baby, 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 I'm on fire. I tell her, baby, 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 I'm a fireball. I conquered, or should I say I saw, I conquered, I came. This little chico on fire, he ain't no lie. Well, y'all slipping, he's running the game. Now Big Bang Boogie get that kitty little noogie in a nice little shave. I gave Susie a little pat up on the beat, and she turned around and said, walk this way.
I was born in a frame. Mama said that every word but know my name. I'm the best you've ever had. If you think I'm burning out, I never am. I'm on fire. I'm on fire. I'm on fire. I'm on fire.
Fireball. Sticks and stones may break my bones, but I don't care what y'all say. Cause as the world turns, y'all boys gonna learn that the Chico right here don't play. That boy's from the bottom of the map, MIA USA. I gave Susie a little pat up on the beat, but she turned around and said, walk this way.
I was born in a frame. Mama said that every word but know my name. I'm the best you've ever had. If you think I'm burning out, I never am. I'm on fire. I'm on fire. I'm on fire. I'm on fire.
Fireball.
You are back on Doctor's Corner with me, Dr. Prabhashni Kupsami, Thursday evenings from 7 to 8, exclusive to Southside FM 107.2. And tonight I have the privilege of speaking to Dr. Devin Chetty, who's a dentist in private practice, and we are speaking about aesthetic dentistry. Please feel free to send through your questions for him on the WhatsApp line 074 345 447, and he will be answering them shortly. So, Devin, back to what we spoke about off air in terms of staining. What do you do to treat staining?
So there's two types of staining, Prabhashni. There's extrinsic staining and intrinsic staining, right?
And for the benefit of our listeners, you can just explain that in layman's terms.
In layman's terms, extrinsic staining, stains on the outside of your teeth. Coffee stains, tea stains, smoking stains,
Right.
Just regular stains from food, right? That's on the outside, basically stains that are stuck to your tooth.
Okay.
Intrinsic staining from the inside of your tooth. So your tooth erupted with a stain already. So that stain is not
Is that like the
just
fluorosis that you
correct,
mentioned?
like
Okay.
the fluorosis. So fluorosis staining, you're going to look at lots of basically white, small little white patches all over the teeth, and it can range from just a single patch on a tooth, right, to one big patch on a tooth, or a few teeth, or all the teeth,
Okay.
right? And I have a.
That's quite difficult for the patient to look at
It
every
is.
single morning.
It is. And I have someone close to me who had that, and when and their mom gave fluorosis tablets and things like that while they were growing up, and his permanent teeth erupted with lots, just terrible fluorosis.
Okay.
And he went and got veneers done when he was 17, permanent veneers, and that would 100% be an indication.
Okay.
Because there's nothing really else that you can do. There's nothing that's going to take away those stains. Those stains are there permanently.
Okay.
So that's would be one of those things. Tetracycline stainings or antibiotic staining, again, can happen during pregnancies. Your mom takes in a lot of antibiotics during the pregnancy.
Mhm.
It's gonna end up transferring to the child. Same, a lot of kids who are on, as you mentioned, on acne treatment.
Yes. We use tetracyclines a lot, and tretinoids.
Correct.
Yeah.
Now,
in
if
acne.
if that child still has any unerupted permanent teeth, there's a small possibility that the teeth are going to erupt with some tetracycline stains,
Even whilst they're off the treatment. Okay.
even whilst they're off.
Because if you look at it, a lot of the teens are
Mm.
on it, and that's when they lose all of the rest of the baby teeth,
Yeah.
and then the permanent teeth are coming
So,
through. So it
if
makes a lot of sense.
if they're going on it closer into the teenage years, then you're pretty safe.
Okay.
Then the permanent teeth are almost all in the mouth already and almost fully developed, even if they're unerupted.
Okay.
Yeah.
All right. And then we just spoke about malalignment of teeth as well, right?
Mm.
And the surefire solution to that. So let's
Yeah.
just touch on braces. Who needs it?
Yeah. Okay. So, I mean, look, everybody knows, essentially braces, we think about kids, young kids, school kids, braces. But you're not really going to know up until the age roughly of about 10 or 11 whether your child needs braces or not.
That's a very sore topic for me because I was 10. No, I was actually not 10. I was in primary school, and I had my first temporary set on, and then in high school I had to have a permanent set on.
Yeah.
It's a very, very touchy topic for me.
I'm sorry. You invited me on this show. Just remember that. So as a child, have you been taking your child regularly to the dentist? Your dentist is going to tell you, right? You'll be able to tell you just by taking an x-ray roughly at around the age of about 6, 7.
Mm.
We can take a
Can
panoramic
predict it.
x-ray and we can predict it pretty much just from that x-ray.
Okay.
Right? Again, I don't know if the listeners remember what we chatted about the last time. Has your child had any primary teeth extracted, while they're still young,
Yes.
without them exfoliating or falling out by themselves? Then chances are that bone's going to shrink, and there's a higher
It
possibility.
puts you at a higher risk, isn't it?
that
And
that
that's why
child's gonna need
the
braces.
dentists don't remove baby
Baby
teeth.
teeth.
Yes.
Correct, unless we really, really, really need to, especially the back teeth.
Okay.
Right? So again, go back to that. Please look after your baby's teeth.
Mm.
But now, as you're going to take your child 10, 11, and if their teeth are malaligned, braces is the only answer.
Okay.
Your dentist will tell you straight up, listen, your child's going to need braces in the next year, and you can actually get the braces on even while there's still 1 or 2 baby teeth in the mouth. As long as there's enough permanent teeth to put the brackets on, then it can be more beneficial in some ways when you actually do that, because then you get the permanent teeth into the right place and wait for those baby teeth.
You're
to grow.
you're actually just molding the formation of it.
Correct, right? So that would be the first indication. Would obviously be for children who are still growing, and parents need to monitor their children and look at and be interactive with their kids and ask them, are you happy? Smile for me, because some children won't even say anything at all, right? So that's one thing. As obviously as time goes on, if you are just generally, let's say as a child, you never had the means to get braces, but now you want to start straightening your teeth, braces is an
It's
answer.
never too late, right? Even
never
even
too
for
late.
adults.
Never too late.
How long does teeth take to correct with braces? Are there different types? Are they?
There are. There's different types. There's different types of wires that the orthodontists use.
Time duration as
Time
well? Like that
duration-
patient you mentioned that didn't have the time to get her teeth aligned?
So she would have looked at roughly 8 months of
Really?
treatment. Yeah.
Really? Gosh, you want to come back to how long I had mine on?
Yeah. So, but you see, hers, we would have just looked at correcting her front teeth. Because what
yeah,
we can also do with aligners and braces is we can also just put them on to tweak certain things.
Yes.
So in her case, her back teeth were fine. We would have
Yes.
just needed to shape, her front teeth.
Yes.
But let's say a growing child, a full term of braces, you're looking at about 2 years.
Okay.
Yeah. But as an adult,
Would you believe me if I told you I had mine on for almost double that duration? Would you believe me?
I would believe you. I would. Yeah. I feel sorry for you though. But
Yeah, I was the nerd going into medical school.
Oh
with
no.
braces on. Yeah.
Well, smile for me, Parash.
Yeah, it's perfect now. It's great now. It worked.
It worked fantastically.
It
Yeah,
worked.
no, it
Yes.
worked.
And so on the topic of adults, you actually specialize in aligners, don't you?
Yes. So nowadays, well, we have what is known as clear aligners, right? A lot of people might just know it as Invisalign, which was the first big international company to bring them out. Now, what aligners are is it as a different form of orthodontics. So it's a different form of moving your teeth, right? It's not to say it's better or worse than braces. It's just different.
Okay.
It's a separate way of moving your teeth, right? So now patients are not, a lot of adults are not keen for braces.
Yes.
So they tend to go for the clear aligners. And the clear aligners, how they essentially work is, I'm not going to go into too much detail, but they are clear, right? And I work with Active Aligners, which is a local
brand.
Brand,
Okay.
yeah. There's lots of different brands, but clear aligners are clear aligners. They all do the same thing.
Okay.
Now, aligners work is they're removable, right? So you as the patient, you're in charge of your treatment, basically.
Okay.
Once I've done my work, I've put little attachments on and we've worked up your treatment plan and everything. Active aligners, they actually 3D print out your full set of aligners. So let's say you need 20 aligners to move your teeth into where we want them, right? All 20 of your aligners come out at once. You come to see me, I do the first visit, make some space in between your teeth, maybe shave away a 0.2 or 0.3 of a millimeter in between your teeth just to create some space.
Okay.
And then you wear your first aligner, and the liner clips in onto your teeth. It's clear. So to the general public, no one's even going to know that you've got anything in your
That
mouth.
is a very nice option.
It is amazing. It
Especially for adults in a working environment.
Correct. And why it works even better is because it doesn't alter your speech at all.
Okay.
Right? Maybe for the first day, you might have a bit of a lisp, but then you get used to it.
Yes.
And you wear the aligner for, 22 hours a day, and you only take it out to eat and to brush your teeth.
So you sleep with them as well?
You sleep with them. If you train with them, you play sport with them.
That's great.
And they literally, so your teeth shift into that aligner. So when you put in a new aligner, it's tight. Your teeth shift into it. By the end of that week or 2 weeks, depending on which system you're using, the aligner should be loose. And then you've got your second aligner already ready there with you.
Okay.
And then you clip in your second aligner. So what I do, I give my patients maybe 3 aligners. So active aligners is 2 weeks per aligner. So I give my patients the first 3. So I'll say, Prabhashni, here's your 3 aligners. Go off and now you treat yourself. If you're not compliant, I will know, and your teeth won't move properly.
That's a much shorter duration then.
It's a much shorter duration. But it all depends on how bad are your teeth really.
To begin with, yes.
To begin with. Because there's been a few adult patients that have come to me that I have had to refer up to an orthodontist, because I tell them straight, listen, aligners, we can get you so far, but it's not going to get you the result that you want.
Okay.
You need braces. You need the heavy duty stuff, because braces are more controlled by the actual clinician.
Yes.
So if you come back or you go to an orthodontist and he can check and be like, oh, okay, this tooth is moving a little bit too fast. He'll just control it. He'll do what he needs to do, and that tooth will be back in place. So if it's a more advanced job, if your teeth are really, really, really crooked, bite the bullet, get the braces. You're going to get that absolutely perfect result.
Okay. That's good advice. A few words on gum disease and how we treat that.
Gum disease, general term, gingivitis.
Yes.
If you don't brush your teeth enough, you're going to have gingivitis. So, generally, we all say at the end of every day, everybody has mild plaque-induced gingivitis. Everybody at the end of the day. So at the end of the day, I always tell my patients to check if you've brushed properly, right? Scratch, take your nail and scratch on your tooth. You'll find that you'll scratch away some plaque and it'll just be like some soft matter.
And that's normal.
That's normal.
Okay.
Right. So then brush your teeth and scratch again. Your teeth should feel almost glossy
Smooth. Okay.
and smooth. That's how you basically know you brushed your teeth properly.
Okay.
So gum disease, go to your dentist or oral hygienist for that matter and get a good scale and polish done. If your gums bleed a lot, it generally means that you need a good cleaning. It generally means that you've got a bit of calculus buildup underneath your gum. So calculus is essentially plaque that hasn't been brushed away and has been left on the tooth to get hard.
Okay.
Right? Some people.
So that has to be manually removed.
It has to be manually removed. Yeah. Okay. Some people call it tartar. So unbrushed away plaque stays on the tooth, bacteria adhere to it, stick to it, and it forms calculus. And that sticks to the tooth. And that can go underneath the gum. And then you're going to get chronic inflammation of that area unless you go to your dentist or oral hygienist for a cleaning.
And are there any medical conditions that would fast forward?
Gingivitis, gum disease.
Yeah.
Definitely. Any and all immunocompromising diseases, diabetes, HIV.
The big one, yeah.
The big ones. That vitamin B deficiencies, vitamin B12 deficiencies, folic acid deficiencies. So it's always important, we as a dentist, I see a lot of patients and we see this, and patients are returning with the same conditions. And I ask them, when was the last time you had your bloods checked? Oh no, doc, 2 years ago. The moment they go and get their bloods checked out, they're back in my room and they realize, they were vitamin B12 deficient, they had a calcium deficiency, they had this deficiency, had that deficiency. So it's not just to say
there's no point treating the surface.
It's not just to say, if your gums are bleeding or inflamed, that it's just a gum problem.
Yeah.
It very well could be a more in-depth medical condition that needs to be treated.
Okay. And then you mentioned more than once in terms of cost of these procedures, right? So the big question that everyone's going to want to know is, does medical aid cover any of these aesthetic dentistry procedures?
Sure. Medical aids.
You could do a seminar on that.
Yeah, we could do a whole seminar on medical aids. The thing about medical aids is what I've found in my now few years of private practice. Medical aids will try their very best not to pay.
Yeah.
Right? They deem almost every crown and bridge procedure a cosmetic procedure.
Yeah.
Right? So honestly, I can't say whether you're, it all depends on what scheme you're on as well.
Right.
If you're on the highest scheme and you're paying the thousands of rands a month, chances are your medical aid will pay. But if you're on any of the normal regular schemes that most of us are on, it may
Probably
just
not.
be a good idea to ask your dentist for a motivational letter.
Okay.
Yeah, because I know with braces and aligners, a lot of the times, 90% of the times, we can motivate that it's a functional correction.
Okay.
And we're actually correcting the teeth, for functionality, so that the patient can chew properly and they're not going to damage their teeth further. And then I've had a lot of success and patients have been paid out by their medical aids. And especially with crowns and bridges as well. If we motivate and we say, look, it's not just for aesthetic purposes, then you may get lucky and your medical aid might just pay a portion of it. But I can pretty much say straight up off the bat, teeth whitening, never, right? Veneers, very, 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 very seldomly.
Okay.
Yeah.
All right. So I treat a lot of patients with toxin, right? Whichever form. For example, for the listeners, Botox, Dysport, and Xeomin in our country. And we use this in the masseter muscles, obviously, to relax the jaw, because patients, to relieve clenching, to relieve TMJ pain, which is one of the joints in the face.
Yes.
And then obviously for migraines as well, from a medical point of view, and as well from an aesthetic point of view, to slim the face down. So one of the indications is bruxism, which is clenching.
Yeah.
So maybe tell us a little bit of what is bruxism, just for the interest of the listeners.
So
How to prevent it, how to avoid it.
How to prevent it. Bruxism, grinding. Essentially, bruxism, grinding and clenching of your teeth, right? Causes, most often than not, psychological causes. Stress, anxiety, those kind of things. And most often than not, the grinding and the clenching is going to be done at night.
Yes.
When you're sleeping.
Yes.
So a lot of patients don't really know that they grind or clench, but they wake up and you might have a headache or pain in your
Tenderness.
TMJ, which is your joint right here by your ears, headache, or just the inability to actually open and close your mouth. It's going to be
Okay.
stiff.
Okay.
That's generally an indication that you're grinding and clenching while you're sleeping. If you're in a relationship, ask your partner. Your partner will tell you straight away, because when you grind your teeth, it is a loud, horrible noise. So how we treat it, before I send my patients to somebody like you for the Botox, I would say, listen, it's a simple matter of making a bite plate.
Okay.
A simple little thing that you clip onto your teeth at night and you sleep with it.
Okay.
And it protects your teeth, and it also prevents you from clenching and grinding. So when you wake up, all of the muscles around the joints are relaxed.
Loose. Yeah.
Yeah. So as a dentist, first line of therapy is a bite plate. Then we look at the Botox, right? Botox and fillers into the muscles around the joints. And then if there's still no improvement and you have clicking and it's really, really bad, we'll send you, to a specialist,
Yeah, a
to a
maxillofacial.
maxillofacial surgeon. Yeah.
And then obviously in the meantime, while they are using the bite plate, we want to treat the cause of the problem.
Correct.
It's always about treating the underlying cause.
100%.
Yeah. Okay. And then I also have a comment for you. We spoke about fillers now in terms of the patients that I would see. So we always look at the profile of the patient's face before we actually advise them on what would enhance their existing, features.
Yeah.
And a patient usually will come with an idea, like you said, but sometimes we have to just because we trained for it, we have to professionally advise them on what's better.
Yes.
And what actually is needed. So when I do lip and chin filler, we normally find that if the patient has existing deformities in the dental structure, the outcome is still not what they are looking for.
Yeah, it's never going to be what they're looking for. It never will. I mean, if you look at patients that have a class 2 bite, which in layman's terms is a deep bite, an overbite.
Yes.
Right? Then, or a chin, the chin is a little bit too far back if you're looking from the side. Now, when you're taking orthodontic records, right, you're taking facial profile pictures of the patient for a reason, because moving your teeth into the correct position changes your entire profile.
Yes.
So again, my advice before considering the fillers and Botox to change your profile and things like that, look at your teeth first.
Correct the deformity.
Correct that first as best as you can, and then enhance it with the Botox and fillers.
Yep.
Don't go straight to the Botox and fillers as a correction, as a correction of a deformity. It's not going to correct it.
Yes.
It's going to enhance what we will then fix. It will enhance what we fix first.
Yes.
Yeah.
Cool. So just as a reminder, we are in our last few minutes now. So just as a reminder, we actually went over the whole Q&A time, but most of the questions there you've actually answered, so it's fine. Let me see. Yes, last question. Remind us, how can our listeners find you?
So my practice is Pearly White's Dental Studio inside Pearls Medical Center in the Pearls Mall in Umhlanga. You can call us on 0861 555 111 and press option 2, right? That's 0861 555 111. And you can also find us on all social media. You can just search Pearly White's Dental Studio on Facebook, Instagram, and TikTok.
Great, thank you. So we have now come to the end of the medical show on Southside FM 107.2, the fastest growing radio station in KZN. And I sincerely hope you've enjoyed the topic and the discussion. So remember to tune in again next week, same time, same place, for another hour on All Things Medical with me, Dr. Prabhashini Kupsami. I want to thank Dr. Devin Chetty for sharing his time and his priceless advice and knowledge with us here at Southside. We greatly appreciate you being here with us tonight.
Thank you so much, Prabhashini. It's always a pleasure coming and spending some time with you. And I hope the information was enough, and I hope the listeners enjoyed it.
Definitely helpful. So guys, remember, you don't have to brush all your teeth, just the ones that you want to keep. That's it for this evening. Next week in studio, I will have with me speech and language therapist Khadija Desai. So make sure to tune into that. My parting shot for today: love is all you need, and a good dentist.
Yeah.
Smile while you still have teeth. Thank you for lending me your ears. And remember, happiness is a habit, and so is your skincare. Taking care of your skin is more important than covering it up. Until next week, good night and God bless.
calm down. Yo, this your body, it puts in my heart for lockdown, oh lockdown. Yo, you sweet life, phantom, phantom. If I tell you say I love you, you know they for me, young girl, oh young girl. No, tell me no, 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 oh, 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 oh. Baby, come give me your lo, 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 oh, 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 oh. You got me like whoa, 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 whoa. Shawty, come give me your lo, 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 oh, 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 oh. I see this fine girl from my party, she wear yellow. Every other girl they do too much, but this girl mellow. Now in my divine situation, I go use they tell I'm mellow. Finally I find way to talk to the girl, but she ain't no one follow. Who you gonna phone for one? When you know I phone for one, then I start to feel a bum bum one. But she did give me small one. I know say she's a people sit down one. But she feeling insecure, cause her friends could they come a light ching go on. Could they come a light ching go on.
Yeah, I know we look shy, but for you I get down low. And my hips make you cry when I'm moving around you. Do it once, do it twice. I push back, you hold me tight. Get a taste for a night. Baby, show me you can calm down, calm down.